So, good morning, everybody. I would like to welcome our guest of honor today, Dr. Bhani Kaur Chawla Kundal. She's a trauma surgeon and intensivist at Riverside Community Hospital, a level 1 trauma center. She did medical school at University of Missouri, Kansas City, and residency as Beaumont Hospital in Michigan and fellowship at Washington University in St. Louis. We are very happy and excited, and we are very honored to have Dr. Bhani Kaur Chawla with us today to share some information on the topic: is COVID-19 coronavirus a myth versus facts, or is it a political hoax? Cases on the rise, but so what's going on? So, if Dr. Bhaniji, would you like to share some information based on your experience?
Thank you so much for having me. I'm really honored to be here. So a little bit more background about me. I work directly with COVID patients on a regular basis. So I've been able to see and unfortunately had to treat some of the sickest patients. COVID is very, very real. If there's nothing else that's taken away from this, I want to put that out there. What COVID does is it causes inflammation of the lungs. That's the main thing that it does, is it makes it very hard for people to breathe. And it can affect anyone of any age, of any creed, of any caste, of any race. And it's very hard to predict which patients will get very sick and which people won't. We definitely know that there are people at increased risk, people that are older, people with illnesses already like diabetes, people that are very overweight, high blood pressure, or immunosuppressed diseases. If someone is on steroids, for instance, for emphysema, or they've had a transplant of some sort, we know that these patients are at higher risk, but even younger patients are dying. Basically, what determines if someone is going to die of this is how much they initially get exposed to. So really, prevention is key in preventing death. It's not anything that's really done once a person gets sick. We do a lot of supportive care, but really very little is in our control once someone is very badly infected.
If you have questions for Dr. Bhani.
Yes, I would like to ask Dr. Barney. Thank you for having me. Anyway, um, as regards to opening of the schools, um, I know the medical community has been slowly coming forward. It only affects the very seniors. Now it affects the middle age group. Now it affects the younger group. And then eventually it also infects children. Um, is it really a good idea to open schools at this point? Or because I also hear that it leaves long-term effects after even when someone is cured. There are side effects that are permanent. So is it a good idea to open schools at this stage?
So that's a very hard question to answer, because there are basically two sides of this coin. There's the medical precautions that need to be taken because of COVID, but then there's also the developmental benefits and the resources that schools offer. So it's hard for me to offer an opinion. As a physician, I think it's important for people to be able to protect themselves, and I think that's extremely hard for children to do. But pediatricians, doctors that work directly with children are recommending that schools reopen, because they feel that the benefits of that social interaction and developmental care and socioeconomic support that schools give is extremely important, and right now outweighs the risks of COVID. COVID does affect children. Children can become infected. How this virus basically works is that it's selective in patients that will become very sick and patients that will be asymptomatic. The majority of people that are young and healthy will be asymptomatic. Really what the risk is with them getting infected is acting as carriers. So they can infect other people that are at higher risk for really suffering from this or even passing away. And it is true that once someone has had a severe coronavirus infection, that they can have lasting effects. What all those are, we don't know yet. We do know that there are, reactions that happen in the lungs and in the heart and in other organ systems as well that can be lifelong. So it's a very difficult question. I would say in an ideal world, the schools would not reopen until we have this virus under better control, either with an appropriate treatment and proper testing and a vaccine. But I just don't think that's realistic because I don't anticipate that there will be a vaccine for at least another year. There are trials that are starting now, but it's still early days for that. So if it is possible to impress upon children how important it is to protect themselves, then having universal masking, regular testing, contact tracing, hopefully those things would help. But I think that's very hard for any school to do, especially as limited as the majority of schools are in their funding. So it's a very hard question to answer. But yeah, I do think that if schools can be opened in a limited way, it would be best for the children.
Baljinder, I have a question. You see in China and South Korea, there is no mention of COVID. Life is running as if it's normal, very few deaths. We see how they controlled it. But is there anybody studying what Wuhan did or what the South Korea did to get out of this pandemic, while understand what they did? And on the other hand, we are culturally different. What they could control, we cannot, because our people don't accept those features what they did. So I don't know if there is anything going on in exchange studies, seeing what's happening over there.
So we know that the initial recommendations that were put out across the world of wearing masks and social distancing, limiting going out, washing hands regularly, that these things work in preventing the spread of the virus. That. Whether or not people do that is unfortunately more of a political question.
Yes. Yeah.
And I think also socioeconomic status has to be taken into account. In this country, not only are we battling the virus, but because of the intermittent shutdowns and how widely spread the virus is, we are in an economic recession. It's quite possible we're actually in a depression, even though no one is saying that. So the ability of people to actually get access to proper face coverings, to protecting themselves, to being able to shelter at home, I think it is very, very difficult and is impossible for some of our population. So people that are well off and choose not to follow the recommendations, yes, they are putting themselves at risk. But then there's a large swath of the country that just doesn't have a choice. I think that our leadership, without getting too political, I think having very, very strong governmental leadership is extremely important in this time. And I do feel that that is something that the country has failed at. And I do think that that is primarily responsible for why there is such a spread across this country. Americans, we value our freedom very, very much. But at the same time, we are no-nonsense, common-sense people. And I think if there had been a consistent message from the beginning, from our leadership at the state level and also at the national level, I think we could have been much more effective in preventing this spread. And I think all of us that have clothes have that ability to at least do that. At this point, the issue is not our freedom, it's our survival. And I think that that is being threatened by this virus, and it is going to have long-term, health and economic and power repercussions for this country if we don't get this under control. And in other countries, as you mentioned, China and South Korea, I think that their governmental systems are a little bit more, they're widespread. I mean, China is a communist country, people's rights and freedom of these types of things are not so much of an issue.
Also, I think I agree that they are a communist country, but they have done, I believe Wuhan lab was established with the help of the Harvard Research Center. And Harvard's head of the research used to visit there frequently and help the students. And the Chinese students from Wuhan used to come to Harvard. So this was in a continuous exchange. And while these scientists are going back and forth, they knew what happened in Wuhan. So this is a sad story.
I completely agree. I'm not wanting to give my political opinion. I'm not trying to influence anybody, but I do feel that there's definitely a gap, a huge gap in what we know as a medical community and what our political leadership is spreading. And I definitely think that a large reason this thing has been under control in the United States is because there have been inconsistent messages from our leadership. I don't think any of us can expect the everyday American to have the same access to medical information or even know what the CDC is, as people that are educated, people that are able to listen to the news, can do so. So yeah, unless there's a consistent message, this is not going to get better. And I do think that the lack of a consistent message and just, trying to sweep this underneath the rug has been responsible for the spread. And we need to work hard now to get it under control. Hopefully everyone now understands that this is extremely real and that people are dying of this. And hopefully that's enough to make the everyday American, take stock. But again, a lot of it in the lower socioeconomic levels has to do with access and resources. It's not just about education. If people are forced to work in industries where they are in close quarters, if that is their only income and their employers are not protecting them and not mandating the rules that have been set in place by the CDC, which are guidelines, really not rules, then they're being exposed involuntarily. So it's a nuanced process. And unfortunately, our country's current political climate is such that it makes it very hard to respond to an insult like this.
Yes, we respect your position because you as a professional has to say on a professional level, you're not involved in politics.
Thank you very much. The other thing which I would also like to bring up is vaccination to cure COVID-19. Is it available or not?
Yeah, and unfortunately, it can actually take years. So there are two things I want to say about a vaccine. So number one, yes, vaccines are actively in development. There are some vaccines that have already passed initial phases of clinical trials and are people are actually now getting a vaccine, and there are 30,000 people in America that are actually undergoing the study right now. And we're waiting to see how those patients are protected against the virus as they, might get exposed in their daily lives. So conducting an experiment like that, it's going to take, several months. But there are several potential vaccines that are in research right now that we know are safe for people to have, but we just don't know if they're effective. Because it's hard to say unless they're actually injected into people and then we follow those people and we see how they do. The other issue is it's not clear if coronavirus will, once there is an infection or once someone has been exposed to a vaccine, if they will have long-term immunity. So unfortunately, even with a vaccine, it is possible that we'll still need to keep all of these other steps in place. There have been multiple reports of people that have been infected with coronavirus once getting affected again. But then there are other cells called T cells that actually recognize viruses and become dormant after an infection, but have the ability to become re-stimulated and to produce in large number if they become exposed in the future. So there are ongoing studies to understand which part of the immune system is really interacting with this virus, and if there is long-term memory that is formed within our cells, whether it's with antibodies or with other immune cells in combating this. So that's not information that we know quite yet. This is another myth that once the antibody, because again, these are studies that have been done, that antibodies will decrease over time after someone has been actively infected with the virus. And the concern is that people will not have long-term immunity.
I guess from all this conversation, we can say just prevention is the only way out at this time to
Right.
just, Yeah, there's nothing you can do otherwise.
At this point, prevention and early recognition. Those
Yeah.
are the two things. While we all work to protect ourselves, sometimes there are situations where one can be exposed.
So, Dr. Bhaniji, would you like to quickly share some of the experience in the hospital with respect to the ICU patients and all the different PPE? We've been hearing many things in the news, but hearing it firsthand from you, who's been fighting it and facing it and treating all the patients. And one of the things that has been said that, the reason we don't see God in the temples anymore is God is in the hospitals, and you are the biggest example of that. So, would you like to share how is the situation in the hospital that you are in, or in some of the other hospitals?
Yeah, so wearing masks has become the norm. Our hospital has been fortunate in that we've never been overwhelmed by COVID-19 patients. We've been able to handle increased, load of patients up until now. That remains to be seen because unfortunately the surge is still on the uprise. So we'll have to see in the future. But certainly at the hospital I work at, things were altered very greatly initially when there was an initial surge. All elective surgeries were stopped. Anything that wasn't an emergency just wasn't happening. I wear a mask, the second I leave my car, and the entire time I'm in the hospital, I'm wearing a mask. My hands have gotten dry. I mean, I used to wash them very frequently anyway, but now I wash them even more. Anytime I touch a door handle, I'm now washing my hands. I go to the hospital in regular clothes, change into my scrubs there, change back into regular clothes, come home and get in the shower and put those clothes in the laundry immediately. So I'm doing what I can to protect my family. Things have returned to normal a little bit in that we're able to do elective surgeries now. We're able to offer services that we were before the surge now on a regular basis. We have very good testing in place. I actually get tested myself pretty regularly on a monthly basis just to know, because it's impossible for me to predict if I'm a carrier or not. Luckily, I've managed to stay safe up until now, but it's really by wearing that protective equipment. So I would say all physicians that are working with, or all healthcare professionals that are interacting with patients that have the coronavirus or are suspected to have them or at high risk to have the virus really should be wearing an N95 mask, which is a special type of mask that filters out 95% of all particles, including viruses and bacteria in the air. That's why it's called 95. And it's something that people actually have to be fit for because it's supposed to maintain a complete seal around the nose and the mouth. So it's not something that layperson can just buy and then assume, okay, they're safe. If there's not a complete seal, then it's not working completely effectively. So whenever I work, with any patient, I have that mask on. I usually have another mask on top of it to try to protect the outside of that mask from getting soiled because we don't have an endless supply of these things. And then I wear goggles as well. And if I have someone that is very sick who requires a breathing tube, then I wear yet another level of protection, which is a full head and shoulder sealant. It's called a PAPR. It's basically this hood that's connected to a separate ventilation filter source that it gets hooked onto my belt or whatever, and will blow in filtered air and then take out the air I'm breathing out, so that there's literally no way I can be exposed when I'm putting in a breathing tube. So definitely extra precautions are being taken, and there's delays in patient care because if I'm having to wear all this gear, gown, gloves, and masks and goggles, and then this hood, then unfortunately, it can take a few minutes before I'm actually able to get to the patient's bedside and able to help them. And I would say the worst thing about this is that it's just very hard to predict who's going to die. And once someone starts to get very ill, there's very little we can do. There's a myth out there that ventilators are the wrong treatment for COVID-19. And that was something else I wanted to address. Ventilators are really not a treatment of any sort. What they are is just an assist. what ventilators do is they take over someone's breathing. So when someone cannot breathe on their own, that's where ventilators come into play. It's a temporizing measure. It's not a treatment. Once the lungs have recovered, or if they can recover, and someone is strong enough to come off a ventilator, that's when we stop that extra support. So it's a support, it's not a treatment. So for instance, if someone had pneumonia, or someone had the flu, or some other lung disease, the ventilator that we would put a patient on with coronavirus or without it, it's not to heal the lungs. It's not to fix the problem. It's to temporize until the lungs are healed on their own. So if, for instance, if someone has pneumonia, we're giving that person antibiotics, we're giving them other medications to combat that illness. And then we're protecting them so that they don't die while their lungs cannot breathe on their own. That's what a ventilator does. So, of course, we try to avoid putting people on a ventilator unless absolutely necessary. But when someone is very sick and they just can't breathe on their own, whether it's with coronavirus or from some other illness, often there is no choice. So I'm doing what I can to protect myself. There are certain maneuvers in the ICU that we can do to try to improve someone's breathing, but all of these things are really just temporizing measures, and it's really just an individual's karma if they, get better or not. I'll have people that are young and healthy that come in walking and talking, but they're just a little short of breath, and then within 3 days they're gone because their body just couldn't handle the virus. So this is very scary. It's very real. It's been something that's been very hard to deal with as a physician, because we like to save our patients. And with the majority of disease processes, we know from the start when someone walks into the hospital if they're likely to survive or not. With coronavirus, it's very, very hard to predict. It's very hard to predict. We know the people that are at risk, but even young and healthy people can die from this. Right now in this country, the death rate is anywhere from 12 to 17%. In the past week, according to the CDC, it had gone down to 8%. But, as the coronavirus has continued to surge, it's not just the number of cases that remain high, but the death rate remains unchanged. It's still up there. 12%, that's enormous. That's a lot of people. So yeah, like you said, Baljinder ji, prevention is really key. It's really the most important thing that we can do. And it's been disheartening as a physician to see people that I think should live, and that, I do everything I can, and yet they still slip away. It's been very, very hard emotionally to deal with that. But I do the best I can to protect myself, to protect my loved ones, to protect the community, and to try to help those that do come in sick. But yeah, prevention is really key. And also with wearing masks, I see a lot of people walking around and they'll have the masks, on their chin, or they'll have the mask covering their mouth and have the nose exposed. That's not protection. That's the same thing as wearing nothing. So whether it's fashionable or not, whether it's comfortable or not, really the only way to truly protect against this is to wear a proper mask, full, covering all breathing orifices, the nose as well as the mouth. Recently, Dr. Fauci was recommending, goggles and eye protection. The truth of the matter is that the way we know that this virus spreads is through respiratory droplets. So it's when we're talking, when we're interacting, we're singing, we're shouting, that's when the virus gets shed and suspends in the air for a brief amount of time. And if someone else breathes that in, that is the main way that this virus is being spread. So yeah, I think eye protection is great if someone can do that, but that's not really the main way of protecting ourselves. The main way is by keeping our mouths and noses covered and maintaining distance of 6 feet or greater. The virus can live on surfaces for a short period of time, but that's really not the main way that this virus is being spread. It's being spread through the air.
Okay, there are some really good tips and great guidance and some really good you shared. Amrit ji, Baljinder ji, Gary ji, would you have any final questions for Bhani ji?
Coronavirus cases have been on the rise. We know that, everybody knows that. But death reported each day remains far less than what we are expecting. Okay, I give you an example about India. India is a global hotspot these days. They have an increase of approximately 1.6 million people right now. The fatality rate is only 3.3% up to June 18th, but 2.21% on July 30th. This is surprise. Death rate is not going up there. So this is the question I have, that even Bombay, then you will say that the 50% population is actually like a cluster. They are living that huts there, and they are exposed to that also. But they have a infection monthly rate is mortality rate is only 0.05%. But we feel that here death rate is not going up. Why? This is okay increasing, but only old people have a problem. So what do you think that we should be scared so much about this?
Gary, Gary G, I'll have to respectfully disagree with you. I don't think the death rate is low. I don't think it's low at all. I think it's underreported. I think there are plenty of deaths that are probably happening in India due to coronavirus that are simply not being reported and not being attributed to the virus. And I think that's responsible for the low number that's being reported. In the United States, where we have a little more accuracy in reporting deaths due to our resources as limited as they are, there's a bit more transparency, I think, in this country. And I think the death rate that we're seeing here, as well as in the European countries, has really been unchanged. I don't think it is decreased. I would say it's anywhere from 8 to 17%, depending on the day. So it's great that there are decreased reports, but I think that that's all that is. I don't think that we can, honestly and scientifically say that the death rate has decreased. And I think that, countries that have limited resources have also been hesitant to admit how impactful this virus is. And I don't think, countries like India have very good testing in place. So I think it's very hard to say people that have actually, had this virus and have died from it. It's hard to predict. And when people come in very sick, sometimes there's not even an opportunity to test them, even if it's available before they die. And so those patients don't even get captured. Even in America, if they die of coronavirus before, we have a confirmed testing. So I don't think the rate has gone down. I don't think that this is something that's, just casual or something we don't need to worry about. I think this is extremely serious.
Beautiful. Thank you.
Yes, I would like to, it's like a follow-up question. Are the hospitals now, do they have enough PPE supplies? I remember they were very low on PPE equipment in the beginning, but do we have enough equipment to protect the frontline workers?
Yes and no. It really depends on where the hospital is. My hospital has enough supply right now, but across the country, no, it's not even. Hot spots, rural areas. So there's definitely more that is needed. And that's definitely another place where people can help, donating supplies. But across the board, yeah, the short answer is no. We don't have enough supplies. And while physicians might, have access to certain things, other workers, housekeepers, technicians, NAs, nurses, oftentimes they don't have the same access, and they will have to wear limited or no equipment when interacting with patients. So across the board, no, we don't have enough, but we're doing the best we can. When I wear that special mask, the N95 mask, I actually hold on to it for a couple of days, which is not recommended. Something like that really should not be used for a 24-hour period or more. But because things are in limited supply, I try to hold on to it for as long as I can until I see that it's become soiled. And there's definitely regulation across throughout the hospital of getting that type of equipment. I have to sign my name every single time I get one of those masks. So, those types of things would not be necessary if we had free-flowing supplies. So there is a limitation. So far, I've been lucky. I feel like overall at my hospital, we've been okay. But that's certainly not the case across the country.
Thank you.
So what you want to give a short message to our Indian community that they have to be protect themselves, especially over 60.
Thank you. Yeah, the most important thing is to wear a mask when you go out. Try to limit the amount of time you go out. Only go out for essential reasons. When one is out, to wash their hands regularly or use a hand sanitizer if soap and water is not available. Although soap and water is really the best way to keep the hands clean. If someone does suspect that they've been exposed, please, seek medical attention as soon as possible. It doesn't necessarily have to be in person. Just a simple phone call to your physician's office can be enough to get tested. So I would say more so than anything, these are the basic measures, the things that have been recommended, as you said, Gary G, by the CDC, from very early on, to wear masks whenever out in the community, maintain social distancing, keep one's hands clean, and try to protect our elderly. So if one does suspect that they are in situations where they're exposed, then they should stay in a different part of the house, if at all possible, from the elderly and other patients with medical conditions that could put them at risk.
Beautiful. Thank you.
Thank you very much, Bhani ji.
Thank you very much.
No,
Barney ji, again, thank you. You're doing a wonderful job. You're saving lives. You are God, and you are saving lives right now. So, again, thank you for sparing time for us.
And I would be happy to come again anytime.